GreenHarvest.Health. I appreciate Columbus Botanical Gardens having us here today. And we're going to do an overview of what we consider the 7 points of cannabis, what you should know about cannabinoid medicine. So this is one particular talk that changes a lot based on people come in and they have questions, and then I realize that's something that a lot of people might not know or we need to clarify. So this is an ever-changing presentation. Oops, sorry, I'm a little trigger happy. So first of all, I'm Dr. Bridget. This is Dr. Barry from GreenHarvest.Health. We're in Pickerington, and we've been physicians for almost 20 years here. And we're the only medical cannabis and coaching clinic in Ohio. So we're certified to treat medical cannabis and certify patients, as well as I have a cannabis coaching certification and a life coaching certification from the Physician Coaching Institute. And our main focus is education, education, education. We go all over Northeast, Central Ohio, Southern Ohio, doing talks at different locations. And so coaching is basically a relationship between the coaching professional and a client to really focus on how they can reach their full potential and things that are involved, because I think many times people are like, what's that weird coaching thing? And so knowing it's a way of kind of asking questions, setting goals, coming back together, making changes that allow you to really have a better sense of who you are and building awareness. And so we use different assessments to get to that point. So we are, Emily just left, she's in the picture there. But we're in Pickerington, Ohio, at 1505 Stone Creek Drive, South, Suite 104. And this is a little picture into where we are every day. So the very first point of medical cannabis is the history. So the origin of the cannabis plant starts actually in Central Asia, Mongolia, and Southern Siberia. I'll push it.
Oh, okay. So whenever we talk about the history, I'll stand over here. So there should be a pin that's going to drop down there. You'll see about where we kind of associated the origins of the cannabis plant beginning. Right in that region, that's where kind of everything's kind of spread out from. And what this kind of depicts is how cannabis has spread since it was first discovered in the Mongolian Southern Siberia region. You can see how it goes, these are BC, so 12,000 years BC is where we first kind of have originated cannabis in that region. Going 2000 BC, you can see how it spreads to India, as well as to over to Africa between 1100 and 700 AD. And then you can see how it kind of travels across the Atlantic Ocean over to the Americas. Most of the American, obviously, has been through the slave trade, is how it came over to the Americas. And what you see is that America started marijuana, cannabis started in America as a landscape. As a crop that actually all American farmers were required to grow. It was used as a form of payment for things. It was a commodity. It was used for a lot of things that have been the fabric of America. Back in the 1910s, there started to be a ban on cannabis, leading to the Marijuana Tax Act in 1937, which basically made cannabis illegal. Not that it made it illegal, it's just that there was a tax put on cannabis, which made it nearly impossible to either grow or purchase. So that kind of made it basically a ban. In the 1970, Richard Nixon signed the Controlled Substance Act, which is the CSA, you may see it that way, which basically put cannabis as a controlled medication or drug, which basically states that it has no medicinal benefit and is highly addictive, which is where cannabis as a whole has stayed until December of last year, where hemp was taken off of that list. This right here is actually the U.S. Constitution, Old Ironside, and what you'll note is the sales. So USS Constitution was used in the War of 1812, and those sails were actually made of hemp. So the sails from this vessel were made of hemp, and I think everyone knows hemp is a very versatile plant, and one of the ways that it's been used is with fabrics, paper, as far as construction. It's been used in many, many different ways, and this is just one of them. I think that one of the newest ways is now there's a hemp milk alternative, which is, I think I saw that this morning, hemp milk alternative. So very versatile plant.
Actually, the original American flag was also made out of
Hemp. Yeah. Well, another note, since you're doing notes, is that the state troopers, their hats are made out of hemp.
That's
So
nice
it's
reminder.
kind of ironic that, a lot of things that are illegal in the state, our state troopers wear hemp on their heads.
Well, they're kicking their head in.
Yeah. This is a depiction of the early Americas, where hemp farming was a big commodity in America, using it for all types of things, such as the construction, such as paper, such as fabric. This is a depiction of hemp, and you'll see the hemp plants in the background, how they're grown very tightly together so that they grow up and not out. So that's one of the things that you see even in early farming. Cannabis in the 19th and 20th centuries. So it was imported into America and was known at that time as Cannabis Americana. And you will find that there are probably at least 5 different classifications of cannabis. And not all of them have Cannabis Americana associated with them, but whenever we were using cannabis in the early 19th and 20th centuries, what we found was that once the manufacturing of other pain medications became popular, we saw a decline in the use of hemp and cannabis for pain medication, because now the manufacturers saw that they could make money off of the products, whereas hemp, which was grown, anyone could grow it, anyone could use it. It was a cheap plant, versatile but cheap plant, and everyone could be using it for medicinal purposes. So what happened was, in 1851, cannabis was entered into the U.S. Pharmacopoeia, and you can see that it was used for spasms, seizures, migraine, depression, inflammatory pain, asthma, opioid dependency, and insomnia. And what you'll notice is that if you look at the 21 conditions for the state of Ohio, you'll see that they all sound familiar. Okay. These are all pretty much the same conditions that you'll see on the list of 21 things for the state of Ohio.
So moving on to point 2 is the endocannabinoid system. So basically the endocannabinoid system is a system within our body. It is a system of balance and protection. It was not discovered until 1992. So when you're kind of trying to have a conversation about cannabis with your physicians, most of them probably did not have any of this introduced to them while they were developed in their education. So basically, the endocannabinoid system bridges the mind and body. It connects every system of our body back to our brain. It helps regulate our sleep, appetite, digestion and hunger, mood, motor control, immune function, reproduction and fertility, pleasure and reward, pain, memory, temperature regulation as well. So within our body, we have our natural cannabinoids. One is anandamide, the other one is 2-AG. And so your body is actually producing something that's very similar to what the cannabis plant is also doing. You have 2 different types of receptors, CB1 and CB2 receptors. And the CB1 receptors are mainly found within the nervous system, the peripheral and central nervous system, where the CB2 receptors mainly are focused within the organs of the body, bone, blood vessels, and the lymph cells. So the THC and CBD are the most well-known of the cannabinoids, but there are over 100 different cannabinoids that interact with our body. So one example of this is that there's a clinical endocannabinoid deficiency syndrome. So when your body is not producing enough of your natural cannabinoids, that the signaling is not connecting, there are too few receptors, or there are interruptions within the function of the endocannabinoid system, you can start to develop many people take cannabinoids for insomnia, anxiety, anger management issues, depression, inflammatory conditions, bone loss, chronic pain, dementia-like symptoms. So when your body is not functioning properly, these are things that you might be seeing. A diet low in omega-3 fatty acids will also bring about the clinical endocannabinoid deficiency. Basically, the omega-3 fatty acids are needed to repair the receptors, and so without it, you might start to experience this as well. So one example of a recent study that was just completed stated that the research has confirmed that underlying endocannabinoid deficiencies indeed play a role in migraine, fibromyalgia, IBS, and a growing list of other medical conditions. Further research and especially clinical trials will further demonstrate the usefulness of medical cannabis. As legal barriers fall and scientific bias fades, this will become more apparent. So we've come a long way from when we were not even having adequate testing and clinical trials to a point where it's being more and more supported. We're a long way off to where it's a part of everyone's natural, everyday medical options, but we've gotten a lot closer. So number 3, do you see what I'm trying to do with the 3 leaves too?
I like
it. It took a long time for me to figure that one out. So CBD and THC. So there's a lot of information out there. Different groups are trying to make CBD the good cannabinoid and THC the bad cannabinoid, which is not true. They do similar things and many times they do different things, but they try to make high being a bad result, and it is simply one of the functions of THC, so we should not pin them against each other. CBD is the non-psychoactive compound for the endocannabinoid system. If you isolate CBD by itself, you'll have less sedation than if you have full spectrum, but then you're missing these other cannabinoids that are important. And not that that's a bad thing, it's just you have to know what you're getting and what you're choosing to use. So CBD can help with nausea and vomiting, pain disorders, seizure activity, which I think we've heard a lot about in the press, psychosis disorders, inflammatory disorders. One in particular, we see a lot of patients for arthritis. Even though arthritis isn't listed as the 21, it's considered a chronic pain. And so inflammatory conditions are helped by CBD. Decreasing the proliferation of tumor and cancer cells, anxiety, depression, neurodegenerative disorders, and so the function is increasing the production of our natural cannabinoids, and it limits the reabsorption. So CBD actually works with our own body to make it function better. The THC is more similar to the actual cannabinoids in our body. One myth is that you can eat it raw and it will also give you the same effect, but you will not get high from eating raw cannabis, nor I don't know how well that would taste by itself. Also, it does need to be heated to be effective, so to go from THCA to actual THC. THC does help with glaucoma, with, again, I said anti-inflammatory and antispasmodic, so you'll see this with Parkinson's, MS, and Crohn's. Cancer proliferation and a bronchodilator. So I have had patients that have COPD and they choose not to use a vaporizer, but they will try to use more of the edibles or tinctures or oils to help with controlling some of their lung issues. Nausea and vomiting, anorexia, so it's actually an appetite stimulant. It decreases neurotoxins in the brain, so good for Alzheimer's, and decreasing brain damage or brain cells that are damaged. pain reliever without stressing the kidneys, liver, and creating ulcers like anti-inflammatories do. Anxiety, depression, alcohol, opioid addiction, PTSD. Not forgetting that it helps with your mood and increasing your creativity, which does come up in our office when we're doing our coaching. And bone metabolism, helping with your arthritis and osteoporosis. At one point, the pharmaceutical companies created a weight loss medication by blocking THC. However, by blocking the THC, people lost weight really well and were also really suicidal and depressed. And so that also actually changed things around as far as I'm looking at what does cannabis actually do and how effective it actually can be. It was never approved in the US, but it was in Europe for a short period of time. So how is medical cannabis consumed? So one thing we do find when we do talks is that a lot of people think you can only smoke it. And medical cannabis, this is dried flower here, and obviously using that to create a cigarette, using more of the pipes there. This is more of a tabletop vaporizer, using more of a handheld vaporizer, the pens. So all of those are different options that you can use for consuming it, as well as baking it in your cookies or whatever it is that you choose. But using it as in food, using it as creating a butter with it. You will find it in a pill form, tinctures and oils, topical creams. So all those are different options for cannabis. So this is kind of came out of a series of questions that we had with a patient had regarding hemp versus cannabis itself. So hemp seed, hemp oil, and the confusion that develops with this. So with hemp, you're going to have CBD, and it's a part of the plant. Many times when you see hemp oil, it should also have CBD in it, though you have to be careful of what you see there. Hemp seed does not have CBD in it, and that's kind of where some of the confusion developed with one of our patients, that the hemp seed is great nutritional value. It has that omega-3 fatty acids that we're looking for to keep your endocannabinoid system healthy. 25% of the total calories are actually protein. It probably works better for you than your chia seeds and flax seeds because of the amount of protein that it has. But if you're going online or if you're on Amazon and you think you're going to get CBD there, you're getting hemp seed, but you're not getting CBD. So you have to be careful when you're looking at the products that you're choosing to buy. And then you come here, and you can actually have someone that can tell you exactly what you're getting. So it's also rich in vitamin E and minerals such as phosphorus, potassium, sodium, magnesium, sulfur, calcium, iron, and zinc. It can help with heart disease, PMS, menopause, and oil for dry skin. So I'm not discouraging hemp seed, but you have to know that it's not necessarily the same thing as CBD. And to also say that it doesn't have the THC in it as well. So one thing that also comes up is the difference between hemp CBD and cannabis CBD. And hemp is the CBD is basically a neurotransmitter here. And so regardless of where you see this molecule, it's still CBD. So if you're looking for vitamin C in an orange or strawberries or grapefruit, you don't distinguish one from the other, it's just vitamin C, CBD is still CBD. So if that often becomes an issue when people are trying to make choices. And full spectrum products versus an isolate, I'm always a big fan of the full spectrum because you get everything, but when you're looking for just the CBD, it's also a very great option. So safety and myths. Do you see the 5? And I think this is the Cannabis rudialis, I believe. So just a different hemp plant. So the myths. So these are all false, just to clarify. So cannabis is highly addictive and causes overdose. Cannabis is not highly addictive. nicotine is much more addictive, let alone the opioids that have been causing a problem, particularly, in the Midwest. So that is not an issue. And because you do not have the CB1 receptors in the brainstem, you cannot have an overdose and you cannot have a death. You might have a bad day, but you will not have death or a severe overdose from cannabis. Another myth that we often hear is that cannabis is a gateway drug, and they actually found that the main gateway drug to going to more illicit drugs tends to be actually alcohol. And cannabis can only be smoked, which, we already talked that there's so many different options that people can use that might work for you. And cannabis increases crime and DUIs. And studies that they did in Denver and in Colorado after cannabis became legal there, that DUIs actually decreased, and there was no relationship between an increase in crime and cannabis use. So this is something that came across to me through some of emails that I had as a physician, that CBD was being converted to THC in the stomach. And I do a lot of medical review officers, so if you work someplace and they do drug testing, I'm the doctor that reads that and calls you and says, sorry, you're positive, okay? So this came across as, you better look out, it's switching in your stomach. All the research was bogus. It was done by a pharmaceutical company to discourage the use of cannabis. The acid in your stomach is never going to be able to convert CBD to THC. It's just a ploy to really scare cannabis users. So that's completely not true. And the last one here, and there's so many more. Like, I just picked some of the ones that kind of come up in our clinic, that marijuana kills brain cells and lowers your IQ. And if anything, it's the exact opposite of that. It's neuroproliferative, and so you're actually increasing brain cells and building more neuron networks, and definitely is not related at all to lowering your IQ.
And we speak to this as well because this is one of the few things that I feel we can almost definitively say that there is enough body of evidence that cannabinoids are neuroprotective.
Yes, absolutely. And it's building new relationships between other neurons. So
It's funny you talk about the neuroprotective nature. There's actually some places, trauma places, like big trauma places, that are actually starting to use cannabis for trauma patients with head injuries, giving them cannabinoids to see if that changes the outcome.
absolutely. Yeah. So I actually did a webinar yesterday, and one of the things we talked about is where do you see cannabis, in the future. And I think it will be cannabis services in hospitals and evaluating patients and determining what they might need, whether it's brain injuries or other conditions. So it's going to go way beyond where we are right now. So safety, and these are true things. So cannabis with THC can cause impairment. So if you have a high THC, we don't recommend you driving your car, operating machinery, that you might not be your normal self, and so you want to be careful and not participate in high-risk behavior. You want to keep away from children and pets. So even though they have found, particularly with dogs, that CBD can do amazing things for your pets, you do want to be careful. They have not found THC to be as helpful for your pets yet, but I think it's really not having enough research yet. And then titration. So you want to go slow and low. Particularly if your body is not used to THC or using cannabis, you want to take a very small dose. You want to go very slow as far as bringing it in. Many times with edibles is the problem, that they see a chocolate bar and it looks good and you have a little bit of it and you don't experience anything, so you come back an hour, maybe a little bit later, and you're trying some more and you're trying some more, and eventually you are very unhappy. So edibles do take a while to kick in, and because of that, you want to be patient. Intolerance breaks. Sometimes people realize they're using more and more and more over time, and one thing to do is to cut back for a while, and by having a tolerance break for a short period of time, you can then kind of restart and then be able to see what level. You want to really try to do the minimum effective dosing so that you still have more room to grow as time goes by. And what to do if you get too much THC, which this, we get calls every once in a while that despite everything that we've shared, they did take too many edibles or what have you. And so you want to get in some fat and fiber to kind of soak this up. You want to have a lot of water, hopefully have a friend by, maybe take a nap. But if you have CBD, and I always recommend that people get some CBD from the dispensary, no matter what, that CBD is going to block the THC and level you out fairly quickly. And so have some of that whenever possible. Other things that you can do is black peppercorns are a natural phytocannabinoid and acts a lot like CBD. And if you are really miserable, you can chew on black peppercorns, and then hopefully that'll normalize you as well. I think you have to be in some bad shape to chew black pepper, but maybe put it on the fat and the fiber. Maybe that's the way to go.
Brian from the Cleveland School of Cannabis has a little quote that is like, CBD is the DD to THC.
Yeah, absolutely. Yeah. So legalization.
Oh, yeah. So just to piggyback on that, they did a research on CBD reversing the effects of THC, because for so long the thought was that just any amount of CBD cuts down the effect of THC, but in the last few months, maybe a year, we found that actually a little bit of CBD actually helps THC work better. So the research study was, how much THC do you need to take to reverse the effects of too much THC? And it was in the range, well, I'll go back a little bit. 4 milligrams of CBD actually helps THC, just that little amount. 4 milligrams of CBD helps THC work better. To reverse the effects of the THC, you'd have to consume 400 milligrams of CBD, which is quite a bit of CBD to consume.
That's your whole stash.
That's usually, if you usually buy a bottle, you see a lot of bottles that are around 400, 500 milligrams. That's the whole bottle. You'd have to kind of chug. Granted, they're small bottles, but so this one is 3.
That one's a big one.
Yeah,
That's 3,000.
Yeah.
Clean Remedies
Don't
will
do
get
that.
you there.
Yeah, this one's 900, so half of that bottle. But
Yeah.
these are highly concentrated bottles.
Yeah.
Usually not that high.
Anyway, so legalization. So for legalization, cannabis has been recognized in 33 states plus DC and Puerto Rico. It's interesting that it's legal in DC, where all the legislators are, but we can't get it legal across the country. 12 states do allow THC for high CBD for medicinal uses, and recreational uses legal in 10 states plus DC, and there's 4 states that actually outlaw all cannabis products. You can see on the map here kind of the progression as time has gone on as the cannabis legalization goes forward. You need the button.
Yeah, I can. I just was watching
Oh,
that.
okay.
Get to the end.
So in September of 2016 was actually when the House Bill 523 passed, which legalized cannabis in the state of Ohio. The whole program was supposed to be up and running by September of 2018, which it wasn't. And then it was going to be December, which it wasn't. And then it was going to be January, which it wasn't. Then February, then March, and April. Then May, which it still really isn't. It's still up and running the way that it was supposed to be. But the first kind of sales of cannabis happened earlier this year. The first patients were entered into the database in actually December of last year. So with the House Bill 523, what it did give was protections for patients in the Ohio Medical Marijuana Control Program. And what it did was it gave registered patients with we protect it from arrest, prosecution, and discrimination in custody matters. Now, I can tell you that the only of those, that first phrase, the only one that really protects you against are the last, prosecution, discrimination. The police can still arrest you because they don't know that you're in the program. Like the police officers don't have access to the database. Even though you can show them a card, they still can arrest you. It's just the second part, the prosecution part wouldn't happen. Registration status alone cannot be used as a basis for a DUI investigation, partly because the police officers don't know that you're in the program. Patients can't be discriminated against when seeking either organ transplant or housing. It protected them from that. Employers do not have to accommodate employees for on-site use. What that does mean is that this was smokers. They don't have to accommodate like a smoking room inside the building. If you're going to be using cannabis and the employer doesn't want that in the building, you will be outside in the cold. Prospective employers cannot refuse to hire due to a person's registry status. Again, they don't have access to it. Employers do not have access to it. The only people that have access to the database of medical cannabis users are going to be the State Board of Pharmacy, because they run the program, and then any physician that is able to enter patients into the database. That's it. Employers don't, police don't, government don't, colleges don't, no one else has access to it. You go. So with the House Bill 523, it also began the decriminalization to a certain extent of cannabis. And what that does is it lessens the penalties related to the possession of cannabis. This was part of the whole process of the legalization of cannabis, which started with the medical program, which hopefully will progress to the full legalization. And so decriminalization is really leading to no arrest, prison time, or criminal record for the first time possession of small amounts of cannabis. Basically, it breaks it down to a misdemeanor, and that's what it is right now. It's just a misdemeanor. The problem is that even with the misdemeanor, you still are going to have to take time out of your day to go down to the court. You're going to lose time to work, so it still is kind of a hassle. It does not encompass selling of cannabis. Selling of cannabis is still illegal. It's not part of the decriminalization. So what this program basically has done is made it okay to have it legally, but it's not okay to buy legally. Okay? And you can't just buy it from anybody. You have to be in a dispensary or be in the medical cannabis program. Okay. These are the states. You saw a depiction of the U.S. on the left before with the decriminalization, and this is worldwide decriminalization. So the states that are, the countries that are in blue, and states that are in blue, this is where it's been decriminalized totally. The ones that are in the yellow, it's illegal but decriminalized. So they kind of just turn a blind eye to it. States in the salmon is illegal but often not enforced. Again, kind of turning a blind eye to it. And then the red ones are just totally illegal. You go ahead. These are the possession of cannabis in Ohio. So you have less than 100 grams, it's misdemeanor. You're not incarcerated, max fines $150, but it's still time out of your day, time away from work. It's not until you get to 200 milligrams or 200 grams you get to a felony, which will be 1 year in jail and $2,500 fine. You can go ahead. One other thing about the decriminalization, in the U.S. it used to be a minimum of 2 to 10 years in prison for possession of cannabis with a $20,000 fine. Not talking about like 5 years ago. This was back in like the 40s and 50s when it was $20,000 fine and 2 to 10 years in prison. That's a hefty fine for back then. Distribution of sale, a gift less than $20 or less, first offense is misdemeanor, and you can kind of see how the other gifts. Gift meaning that I'm like actually giving it to you, I'm not selling it to you. You can go ahead. Go ahead. So cannabis and the law. And these are some of the next slides are going to be some of the common questions that we oftentimes hear in our practice about cannabis and the law. One of the biggest ones, hit the button please, is Ohio concealed carry handgun, okay? So, first off, the concealed carry laws are changing. They may actually just get rid of it. Ohio's already an open carry state, and you can walk down Pasemont here with a gun, and it's totally legal. But concealed carry. The most important thing about the Ohio concealed carry is that on the list of what you need to be check on and check off, check no and yes to is, hit the button, is are you a unlawful user of, addicted to cannabis or any depressant, stimulant, or narcotic, okay? Now, when you're in the program, you are a lawful user, okay? So when you come to this question, it's section 4, question 4. Section 4, question 4. Section 4, question 4. When you come to this, are you a unlawful user? No. Okay? Then you have your concealed carry.
But on a national level, it's.
On a federal level, I think it's section 11 or something like that. It's a completely different question.
Yeah.
Okay, it's a completely different question. Most people don't have a federal concealed carry. That's like CIA.
No, I mean, even buying the handgun, that's in the paperwork that you fill out.
Right. But for the concealed carry, it's a little bit different.
Okay.
In Ohio, whether or not you have a medical cannabis card, it's not e-verified. So that means that there's no database that they can check in. It's up to you to tell them. Okay? So it's based on the honesty rule. But for federal concealed carry, it's a different question. You will have to check yes, because they put in parentheses another description. Your employer and disability. Employers are not required to accommodate an employee's medical marijuana use. It does not prohibit an employer from refusing to hire, discharge, discipline, or otherwise take an adverse employment action. What this means is that employers are private businesses. Their rules are their rules. There's no federal rule, there's no state rule about what employers can and cannot do when it comes to cannabis use, whether you're using it illegally or legally. It's up to them and their rules. One interesting thing is that recently New York City passed the marijuana justice legislation, which bans private and public employers from testing potential employees for THC, which is what they really test for. They don't test for CBD, they test for THC. The only downside of this is that there's a workaround for employers, is that they can hire you without testing for THC, and the next day they can test you when you're an employee and then fire you. So it's really kind of not the best legislation. As far as disability, we get this question a lot. Social Security Administration can factor use of drugs or alcohol in determination of eligibility of benefits. If drug or alcohol abuse is contributing to your disability claim, it can be denied. What that means is that Social Security can technically deny your claim for housing, your claim for disability in general. They technically can do that. I've never seen it done, but they technically can do that.
And how would they know?
How would they know? It's a good question.
Mm-hmm.
The only way that they would know about that is if your physician told them. So it's not something that you report to them. As far as the disability claim, your physician has to put that in your paperwork that you're a cannabis user. And as far as housing is concerned, that is a place where you have to tell them that you're using cannabis. You have to tell them that. HUD can't deny housing for medical cannabis use by anyone in the household, but that's really up to you telling them.
So on HUD, it's not a database either?
They don't have access to the database.
Wow.
The only people with access to the cannabis database in the state of Ohio are the state board of pharmacy, because they run it, and then the physicians that put the patients in the database. That's it. No one else has access to the database.
Huh.
I would just presume that on the federal level they would have access.
No one has access to it, because all of the every state has a different program, and so the federal government doesn't have any jurisdiction over it at all, because it's all state run.
Oh, the last one here. So number 7, how to obtain a card. So first, is medical cannabis right for you? So everyone's a little bit different. It's not, everything is not the same for everyone. Some people might find cannabis to work for them. Some people find that CBD alone is perfect for them as well. But the nice thing to know is that it's helped a lot of people manage conditions. That it is definitely safer than opioid use, which has led to 19,000 deaths a year just from prescription use alone. Cannabis in the long run, despite what you might feel right now in Ohio, is actually more cost effective. $3,000 on prescription meds a year is paid out to many, or many seniors pay for their prescription medications.